Yes, welcome everyone. We are very excited to have you here today. And before we do get started, before I introduce Otto Lee, who is our one of the county supervisors, I wanted to welcome all of you. And we have both league members and friends here. We've invited the leagues from all over the county. We have 5 leagues in Santa Clara County, so we welcome all of you. We welcome everyone, if you're not a member, to join our nonpartisan political organization, which encourages informed and active participation in government and influences public policy through education and advocacy. We do not support or oppose any political party or candidate. So this is an election year, as you know, and we're all getting ready for the June 7th election. The final list of candidates and measures are now available as of last week. So we are madly planning candidates forums, often with our neighboring leagues. And so watch from our website. So you will see what forums are coming up and you will see what pros and cons events. We have a few local measures, which we will probably talk about. And then of course, eventually Voters Edge will be up and we hope all candidates will participate in that. So now I would like to welcome Otto Lee. And he is one of the 5 supervisors of Santa Clara County, as I said. He grew up in Hong Kong and he came to the US with his parents when he was 15. He graduated from the University of California at Berkeley with a BS in chemical and nuclear engineering, and then earned his law degree from UC Hastings. He served 28 years in the Navy, retiring just a few years ago, and was awarded the Meritorious Service Medal for his years of honorable service. He has been very active in the community of Sunnyvale for over 25 years. He served on the Sunnyvale Planning Commission, and then he served on the Sunnyvale City Council from 2003 to 2011, including 1 term as mayor. In November 2020, he was elected to be the county supervisor for District 3, which includes North Sunnyvale, Milpitas, and the Alviso, Berryessa, East Foothills, and the Evergreen and Rosemary Gardens neighborhoods of San Jose. If you think of questions you'd like for him to answer, please enter them into the chat. So welcome, Supervisor Lee.
Good afternoon. Thank you. Let me get my camera working here.
Yeah. Yes, we will hope.
Okay, good.
Yeah, we hope that you will speak for maybe 20 minutes or so. Is that about the right time for you?
Sure. I'll speak, and if there's any question, we could have a little chat and make it as informal as possible. And anytime we're able to talk this way. Can you see or hear me? Okay.
Yes.
Okay, very
Yes.
good. Yeah, good afternoon. First of all, thank you.
I have one more little thing. As far as the organization of the program goes, we're asking you to speak first for about 20 minutes or so. That's up to you. And then I'm going to interview Gloria Chun-Hu, who will be the moderator for the rest of the program. And we have questions that came in ahead of time, and we've invited people to enter questions in chat. And so she will be glad to ask those for you. So you do not have to do that.
Okay, all right, very good.
Thank you.
Well, yes. So first of all, good afternoon, everybody. I am Otto Lee, your county supervisor for District 3, which includes Milpitas, Sunnyvale, and actually is now the whole Sunnyvale. The district actually changed about a couple months ago when we do our redistricting. And of course, also Berryessa, and then now district actually lost Evergreen, technically speaking, because of the moving of the lines. But certainly, we're still very much honored to be representing and still serving Evergreen in many ways. So many of the constituents have questions. We still have to deal with that, those requests as well. So first of all, happy St. Patrick's Day, and also happy Women's History Month this month. And thank you very much for having me here today. And I certainly want to say, with the news to everybody, here's what's going on in Eastern Europe. I certainly want to say that we certainly have the strongest support for Ukraine and the people that's suffering right now, and hope that this end of the Russian invasion would come soon. As a veteran who also served in Iraq, in Baghdad back in 2009, I certainly have personally experienced these terrifying realities of war. For example, having these bombs and rockets attacking these, apartment buildings and schools, and that we saw in the hospital. It's really horrifying because I myself have gone through quite a few of those when I was in Baghdad. I missed one by 90 feet. One of the mortar landed 90 feet from me. So very lucky to be here today. But certainly my thoughts is with the families and the loved ones and friends and many of those who are in Ukraine. And I've also done some traveling recently. I was just outside California, and we certainly do feel that the war is being felt and being, concerned by everybody and everywhere I went. And, I was very thankful. For example, there was a moment that I went with my friend Christine Pelosi, our speaker's daughter, who I've known for a while, along with the Carolyn Fowler, the chair of the Women's Caucus in California for the Democratic Party. And we went to visit the Ukraine House in Washington, D.C., where we were able to leave some flowers and say a prayer and wishing them peace there. These images certainly, the videos or the stories certainly have, affected, everybody right now. It affected our wellness, our mental health in many ways. And of course, with the pandemic that we're going through, that we're supposed to be getting out of at this point, certainly we have been going through very stressful times. It's been very difficult and hard for many, many families. And I just want to encourage everybody, to obviously to reach out and talk to somebody. And it's certainly important to be able to go get help, because we all need it. And there is absolutely no stigma and there's no shame of trying to get help. And letting your friends and family know that it's certainly okay to get help and talk about how we're feeling through all this is extremely important. And we're always here to help guide you and any of the neighbors to get help at our District 3 office at our county at 70 West Heading. In case anybody wants to reach our office, I want to do a quick plug on the phone number, which is 408-299-5030. Again, 408-299-5030. And that's the number that we deal with all our constituencies' questions and concerns. Speaking of Moscow issues with Ukraine, next week the Board of Supervisors actually will be discussing on how we can best support Ukraine, and hopefully using our connection, because we do have a Moscow City Commission through the sister county commission relationship, to hope to influence those commissioners over there and to support the people at the end, to hope to end this Russian Federation's invasion and attack on Ukraine. The recent travel that I spoke about too was I was in DC actually last week. This is for it's a political meeting for the DNC, which I serve on. But at the same time, it being the first time the DNC actually met in person, we got some pretty interesting guests. President Biden actually spoke with us on Thursday for a good half hour on the various things that's happening and the accomplishment that he's done in the past years. Obviously, he's very happy with many of the bill's passages, whether infrastructure bills, whether it's the COVID relief funds that's been coming to our community, and the ARPA funds, American Rescue Plan funds, that's been going to so many communities. That's really saving lives in so many ways, directly and indirectly. And then I was able to. And of course, he was not very happy with his poll numbers, but that's a separate issue. And also get a chance to meet with Vice President Harris, who just actually returned. I met her on Saturday morning when she just returned back from Romania and Poland from her trip dealing with the Ukraine issues. So very much very topical when we met them regarding what they are dealing with. And I'm certainly happy to check with anybody later on if any questions relating to some of those interactions with the leaders of our country. Coming back to our county here, I just want to make a quick announcement regarding a process that's really important that a county does that a lot of people might not be aware of. For example, every March or so, there is this inventory grant program that the county provides by the 5 supervisors office. So each office get a chance to propose and nominate recipients of the 501c3 organizations to receive funding to do their good work helping our community every day. For our office, we have this thing called the Urgent Grant Program, which is a kind of a subset of the inventory grant process. And we saw these grants last year after I got elected to use it to support local groups and organizations that are working, helping our community, feeding the unhoused, feeding seniors, mental health issues. Like NAMI, for example, we gave a sizable grant to NAMI last year. The Loaf and Fishes that was giving out food to, literally millions of meals that were served last year. And even small organizations that could use money to, for example, procuring material to sew blankets for our unhoused and sleeping bags and jackets. So small grants, big grants, small amount, we give as little as $2,500, I believe, and then all the way up to $40,000, what we gave out last year, depends on the size of grant. We gave out over 70 different small and good size, large size grant. And so I just would like to say, go visit my website, which is www.supervisorlee.org to learn more about this urgent grant programs and this inventory programs. And also, don't just think of District 3, my office. The other offices, Supervisor Cindy Chavez, Supervisor Susan Ellenberg, Supervisor Mike Wasserman, and also Supervisor Joe Siminian, we all have the ability to give out these type of funding. We certainly have different criteria that we use, but in any case, I would say if you have some type of a project that you would like to get funded for this coming fiscal year, please look into this and apply to the different offices as well. Usually our offices, that depend on which area the organization serves, that's usually very likely where the supervisor would be more inclined to provide help in funding those areas. Now, today, I believe our primary focus is talking about the state of healing of those of us in the behavioral health, healing our mental and emotional health in our Santa Clara County, and the new facilities of how we are also expanding programs to serve everyone. And, as I'm watching also my 3 daughters, I'm a father of three young girls, 17, 14, and 10-year-old. I'm very thankful that certainly they have provided the space to talk about their mental and emotional health, and that our society has also embraced a focus on health and wellness these days. And I would like to share a few numbers with you. And these are numbers that we got from NAMI, the National Alliance on Mental Health, saying that approximately 1 in 5 adults experience a mental health condition everywhere in America, and that 1 in 25 adults live with a serious mental illness, SMI, such as schizophrenia or bipolar disorder, and that 1 in 5 children ages 13 to 18 years old, half will have a serious mental health conditions. And that half of the mental health conditions begin actually by the age of 14. And that 75% of mental health conditions actually develop by age 24. So these are the statistics we got from NAMI, which is very real and very disconcerting given how prevalent it is in our community. We're also experiencing and creating this shift in how we are seeing and treat mental illness and how we address our mental and emotional health, because we are, of course, connected to this and we all go through these type of challenges every day. For my generation and those before me, talking to someone, right? We say talking to someone was only something someone did if they had a serious problem, something very big. We were expected to kind of figure it out or just deal with it, especially for a lot of men, a lot of cultures, the macho-ness of it. Why, suck it up, just deal with it. Those influences has kept many of us and our neighbors from seeking help. And these type of stigma of seeking help is far too often a serious barrier in improving our wellness. For example, I myself have lived with somebody who has mental illness while growing up in my family. And having seen these episodes, a normal person and suddenly would just go into this tantrum, thinking that maybe it's my fault, maybe it's my sister's fault, we're the kids, these are adults. And at the end of the day, the tantrum will go away. And then a few weeks later, it will come again. And it's just repetitive, it go away. And for a while, you realize, wait a minute, it really wasn't me. It's that person that has the issue. And it was something that I could see by seeking help and actually getting type of medication. There's definitely a way to deal with it and improve on it. I think it is so important that seeking professional help is something that is I have personally experienced in my own family, that this is something that's really, really needed. And the stigma many times is the reason why people are not doing that. Now, the best part is that getting help and feeling better can happen in many ways. Sometimes it's therapy. Sometimes it's with help from a group of activity, and sometimes it's just about making sure we take time to care for ourselves. Santa Clara County has been a leader in supporting our wellness, and I must acknowledge that the great work being done from our Behavioral Health Services Department and the Public Health Department and all of our healthcare providers and community partners. Thanks to this unified effort, we're caring for improving quality of life for our residents right here. The Board of Supervisors has also been working on this issue for a long time. This is a priority for me and my office in District 3 when we first hit the ground running on the day one to see how we could support and improve the care the county provides. 2020 and 2021 have been really tough years during the pandemic. And as we looked into 2022, we knew that additional measures were necessary to address our mental health and substance use. I worked with Supervisor Sun Ellenberg on a joint referral to declare that mental health and substance abuse use being a public health crisis right here in Santa Clara County back in January. And this has activated our staff and community partners to move forward, expanding more programs and resources to be made available. Since declaring this mental health and substance abuse a public health crisis, the staff has been working on actionable items to report back to the board in our April 19th meeting with options to expand our access and support services. Thankfully, we have a very strong network of care facilities and community partners to help provide these mental and behavioral health services and address the substance abuse. Today, I'll be joining the Behavioral Health Service Department at 4 p.m. for a virtual community conversation event about mental health. The BHSD is currently working on a community survey to improve care and services and closing gaps in care. This feedback will inform future mental health and substance use priorities, programs, and policies in the county for the next 3 years, which will be rolled out during fiscal year 24, 25, 26. It is part of a whole series of meetings that the BHSD is having with our community. We certainly have been exhausted, but as we have already proven, we are also resilient. There are still many stressful days ahead, I'm sure, but I see that future that's healthier, happier, safer, and stronger. The more difficult side to addressing the mental health is those with serious mental illness who have fallen to the justice system or become some of our chronically homeless. One key item that I would like to acknowledge is that when your housing security is at risk or when you become unhoused, this has a very real negative impact on anybody's mental health. Fixing our housing quagmire is certainly a compounding issue that has ripple effects. How the county manages custodial responsibility has been a flashpoint for many years now, and there's been a very strong movement calling for a care-first approach. And we're doing it. We're working so that those who need help are suffering from a mental health break or illness do not end up incarcerated. We are going to build a new mental health focused facility, and we're going to tear down Main Jail North and build a new facility that would treat humans with decency, respect, and humanity. We're going to pursue alternatives to incarceration, and we're going to provide care. Having served on the Blue Ribbon Commission on custodial reform about 6 years ago, I have been very close to this issue for many years, and I've seen how we are not reducing harm, and we really need to do better. The status quo is not working. Another path the county is also pursuing is with the assisted outpatient treatment, some known as the Laura's Law. We're going to provide beds for our neighbors that are in the most extreme need of care and security to themselves and others. While this program is for quite small population, somewhere around 50 to 100. It's also a group that have needed more help for a long time, and that we now have the program and the services and resources to hope to provide this. And this is not a new program at all. This is something that's already been implemented in most of the counties in California, and I'm glad that we finally were able to get that passed. And I could certainly discuss this issue further, and I want to make sure that we have covered a few of the questions about mental health later that was shared by today's attendees. So when you ask me questions, I hope I could help address them. And I think I've been spoken for about 20 minutes now. So hopefully I was able to cover most of the issues you want me to talk about. But again, thank you very much for having me today.
Oh, thank you so much, Supervisor Lee. We're so glad to hear what you said about this. I was a little shocked myself by the statistic of how early these issues show up in our youth. I would like to introduce Gloria Chun-Hu, who is a board member on our local league board, but she is also the first vice president of our League of Women Voters of California, and she works in the area of action. So whenever we see the state taking action on this with the state legislature, Gloria's been involved there somehow. So thank you very much. Gloria, if you have any more questions, we have a lot of questions to ask, but if you have them, continue to enter them into chat. If you would prefer to ask them yourself, you may click on raise hand and I'll try to call on you when we have time. So Gloria, turn it over to you. Thank you.
Thank you, Carol. And Supervisor Lee, thank you so very much for joining us today and sharing with us a little bit about your background and your leadership in the military, as well as a civic leader. I also want to personally, on a personal note, thank you for the hard work you're doing on the anti-Asian hate campaign and working so closely with the Asian American Pacific Islander community. That's been really wonderful, that kind of leadership. It's so sad that this is happening in our country, and I'm glad that more people, yourself, as well as so many young people, are speaking out against these activities that are happening. You covered some of the questions that were asked. We've had over a dozen questions that were asked. I'll try to consolidate a couple of them. You spoke a lot about Laura's Law, and that's wonderful because the League of Women Voters has been very concerned about the criminal justice system. We're focusing on reform throughout the state. And especially about the criminalization of homeless, as well as those with mental health issues or behavioral health issues. Can you speak specifically to what the county will be doing? One of the nice things we know is Governor Newsom has made available, something like, was it $4.4 billion to be used in the next 4 years, 4 or 5 years on the Children and Youth Behavioral Health Initiative. Really focusing on our young people. And as you said earlier, if we can catch this and address these earlier, we will save ourselves a great deal of pain and problems in the future. Is the county, what plans does the county have to perhaps utilize some of these new state funds that will be delivered to the county in terms of how it will be used? Are there any new initiatives, or is it primarily going to do the kinds of things you've already addressed with, such as the new facility you talked about and the Laura's Law implementation?
There's just so many things that we are now doing and seeing the need because many people felt that the big problem we have is homeless. There's so many homeless people around, right? That's what everybody is talking about, and they see in the streets, they see what's on the roadways by the highway, right? But again, we also know that many of those who are unhoused right now, and I would say good half of them, not more than half of them, actually also suffer from mental health and other type of issues and drug issues as well. So there are so many things that the county really need to put together. So we talked a little bit about the building of the mental health facility that hopefully would help some of those who shouldn't be incarcerated and have a place to go. But in addition, we are building already a child and adolescent psych facility at the VMC at the Valley Medical Center. There's a parking lot that will be demolished. We're getting ready to get bidders for that, and we expect that demolishing will probably happen in the next 2 to 3 months, actually, to build a child and adolescent psych facilities with 77 beds, of which about half of the beds for child and adolescents, 14 for children, 21 for adolescent, and 42 adult beds as well. There's outdoor space for recreation yards for patients, emergency psych services, EPS, pharmacy, operational and administrative space. So that's something that's already been approved and funded. And right now we are having a little delay because the contractor that was initially selected, Excel Construction, is not able to meet the deadline that we've given them. So we are actually rebidding that one out so that we can find somebody that could do a better job and meet on time and hopefully on schedule and on budget, right? And you know, the county certainly has been investing a lot of resources into other new programs as well, and we're hoping to use all these type of ideas to make it happen. Obviously, to get it settled down, you know, back on track takes time for anybody suffering from mental health, and we certainly do not have enough beds and spaces to provide those with the chronic needs right this moment. We have, for example, in terms of the beds we're talking about, we are working to improve our bed tracking system. Currently, we have different systems that track the bed capacity for outpatient services, inpatient and residential services, like we call IMD beds, supplemental board and cares, adult residential, crisis residential, shelters, EPS, and within our criminal justice system too. It's not really integrated, and there's a lag with the data, so that oftentimes there'll be vacant beds that people don't know they can put people in, and they were told it's full. So we're trying to find a better system to just basically identify where these beds are in real time, so that people will be able to be placed in a much faster, a more accurate fashion in terms of time. For younger adults, we have the Alcove system, which is an integrated healthcare center that brings together mental health services and primary care services together. That's the key, is that it's not just mental health, but we also mirror it with the MD and primary care service together, and that's new. And in addition to that, there's also employment support and educational support there, where like one Alcove Center in Palo Alto has been very successful, and another one is in the process of being established in San Jose as well.
Might I just interrupt for just a second? Related to that was a question asking about how are we perhaps working or not working with the school system, because that's certainly a place where many of the young people might be identified in terms of having some problems.
Exactly. No, that's exactly right. And the Alcove goal is to work with young adults from age 12 to 25, and we serve all of them with or without insurance issues and with their needs. And then the other thing is SLS is called the school linked services, something that really needs to be expanded to more school districts across Santa Clara County. Currently, SLS schooling services is at 17 of 32 school districts, and we plan to have it continue to expand to other schools in the future fiscal years. Other areas that we talked about, like just yesterday, we talked about this Navigator program. The Behavioral Health Navigation is a new program that's already in existence in some other county, like the Tri-County area. I believe there's one already in Los Angeles. And this type of idea is a person-centered service delivery approach that helps eliminate the barriers to timely access to care, ensuring linkage to the right service at the right time. The idea is that by having a one place to go, because as we all know, the county is very large and the various services that we give are very convoluted sometimes. We need people to be directed to the right place the first time and not being turned away. So hopefully by having these type of a one-stop shop approach, it would provide some type of a seamless coordination across the systems of a county to provide the collaborative care for primary health and other community partners. The current is in the planning stages, and we hope that this will actually get launched in the next 4 months by July 2022. This model includes peer staff. Peer is really important because these are folks who have experienced mental health issues themselves, and they really understand what the client is going through. So the peer staff with these lived experience will offer person-centered approach for the individual's needs, ensuring the linkage, the resources, and the referrals, and conduct, of course, follow-ups. And there will also be some drop-in centers within the county that will include in-person and virtual workshops to welcome and orient the community and consumers to the behavioral health system and services. And this also will also have workshops that's also peer-led as well. The navigators will
Wow.
provide resources and linkages to specific activities and also provide for recovery and resiliency, of course. Okay, sorry about that.
Oh, no, this is just extensive. It's wonderful to hear about these things because a lot of us are not familiar with it. We haven't used the system or are not aware of what the county is doing. So this is giving us a good number of ideas about what is happening. Many of them were launched. And I know one of the criticism of the mental health system statewide, and to some extent here in this county, is that it's somewhat a fragmented system, the revolving door, and sort of this concept of you have to go from, it's not an integrated service. You go to one place for this, another place for that. So this navigator system, which we know somewhat about and has been used and piloted elsewhere, it's good to know that it's going to be happening here in Santa Clara County as well.
Right.
And then you talked about the network earlier in your opening comments of you're working with other providers and then in the community. I presume that some of these programs are going to be working with some of these providers. It won't all be delivered by the county, but through providers. Is that my understanding?
Right. Yeah, no, actually, a lot of the services will not be delivered by the county directly. The CBOs, the community-based organizations, a lot of these are nonprofits. They are really the one, like Momentum for mental health, led by the executive director, Dave Manetta, for example, will be an example. I used to be on the board serving another nonprofit called ACT for mental health. A lot of these different mental health CBOs that work with behavioral health every day, those are because belong to the Behavioral Health Contracts Association. They are the ones that actually runs a lot of these type of organizations focus on certain areas that they're good at. So I think it is very important to make sure that we are able to work closely with our community leaders and these organizations.
There were a number of questions, Supervisor Lee, about this new concept that the governor has just described earlier this month called the California Court Care. Which is a community assistance, recovery, and empowerment program, and that is dealing to help deal with emergency psychiatric problems. It's brand new. I don't know if all of the state regulations and requirements are even out yet, but are you familiar with this? The California Care System, but it's an approach people with severe mental health, but it also requires some mandated court intervention. Do you have any thoughts about this? Are you familiar with what this is going to entail and how it might affect what we do here in the county?
Yeah, this is a very new program. The Care Court, as they call it, I believe, is Governor Newsom's new proposal to help support the Californians who need the most care, but too often falls into the jail and carceral system when they really need this long-term rehabilitative care, right, for the mental health. This new program is supposed to provide support for those with untreated mental health or substance abuse disorders, or both, right? And to be able to get not some short-term, revolving door thing, few days, a few weeks, that actually potentially to get a 24 months of plan of care, a long-term care. This approach is intended to get people the care they need, get them out of the streets, out of the jail, and provide our entire community a safe and just way of providing care to our neighbors in a humane way, or to our family with serious mental illness. And I really am hopeful that we can actually find success in this type of a program.
One other specific question has to do with what about the 159 acres at the fairgrounds? Could that be used to shelter the homeless individuals or provide mental health services?
Sure.
I think that's a tough question. I don't want to put you on the spot. Has that ever been in consideration? But it is a question that was asked.
Yes. Well, the fairgrounds have continued to be offered idea for our house neighbors, and I want to make sure portions of fairgrounds are made available also in case of major emergency or disaster or temporary location as well, right? The fairgrounds certainly has struggled to be a good solution to homelessness, just like the fields near the airport. There are safety concerns and lack of access to services. And these are not enough accessible public transit pathways that we have wraparound services for us to utilize. Also, some other elected officials are clearly not very supportive of the use of fairgrounds for their house. Now, speaking of my own personal view, I do think that maybe some type of like RV parking area for some of those unhoused would certainly be one of the easiest to implement at the fairgrounds, as there are plenty of old, dilapidated cars that's being parked there right now anyways. And so a properly managed RV parking certainly could potentially improve the area even. And we're also finding some success in San Jose, Milpitas, Mountain View, Sunnyvale, to utilize the spaces within our communities that could provide these wraparound services, and not necessarily just use the fairground. So it's certainly an idea, but I would say we need the at least 3 votes on the county to get this through. And I'm not certainly against the idea of all, but I think we need more of my colleagues to buy in first, especially those representing the area where the fairgrounds is situated.
Okay. Let's see. I'm looking at a question that's just come in. Let's see. I'm going to ask perhaps if Carol could help me out, because I'm having trouble tracking that as well as tracking the questions we have. I'm just going to turn you into a slightly different, it's an opportunity to have you here to talk about the county. We appreciate that. There are some questions that are outside of mental health. I wondered if you would be comfortable addressing that. Are there plans to update the county general plan to include more climate protections? That question probably came from one of our many members in our climate change committee. and you spent many years as a planning commissioner, and I too spent. I was a previous planning commissioner here for the city of San Jose, and so we understand that the planning commission is really important because their decisions affect longer term decisions and help us make those decisions. So the county general plan is something that a lot of folks have been talking about lately, including the fact that the law, some years ago, the county plan helped preserve a lot of the open space, which we're so happy for, and made some good decisions that would carry us the long term. So it's come to our attention that the current county plan, general plan, is quite old and rather dated. So is there any chance that will be updated soon to reflect, where we are and looking ahead?
Oh, definitely. The County Office of Sustainability and the Department of Planning and Development are actually working closely together to incorporate these more preparedness and resilience to our climate hazards and impacting our county's general plan. Right now, the county is taking steps to update the safety element and local hazard mitigation plan to include climate risk and resiliency goals and strategies into the county's general plan. In addition to these changes, the county just also adopted an all-electric REACH codes in December that requires all new buildings in unincorporated areas in Santa Clara County to switch to electricity and not natural gas, plus new construction to include infrastructure for charging electric vehicles. Now, just a little history. I was on the Sunnyvale City Council, and while I was mayor, one of my main focus during that year as mayor was to introduce the green issues, and I formed a mayor's office of mayor's green ribbon committee with many of our community members in Sunnyvale, and they came up with many great recommendations. One of which included was the start of looking into forming a sustainability commission for the city, which eventually got established, along with many of the environmental adoption of like putting solar panels on government buildings and trying to make requirements of these LEED certification for commercial buildings. And most recently, after I got on board of the Board of Supervisors here in county, I have surprised to find out that we actually have a fairly small county Office of Sustainability, and we actually do not have a green or sustainability commission for the entire county. So I have made that referral, and the county now staff is putting together the proposal to come up with plans to actually get the establishment of a new sustainability commission for our county.
Well, that's great. I think many of us who understand the value and importance of land use issues and how it affects our future are glad to have you on the Board of Supervisors with that perspective and the need for good county planning. The other question has to do with outside of mental health is redistricting. I will tell you that the State League of Women Voters, which proposed the Independent Citizens Redistricting Commission at the state level, has been pushing for it to also happen at city and county governments as well.
Right.
San Jose, as did Santa Clara County, developed advisory redistricting commissions and then totally ignored their recommendations and came up with this. How do you feel about the process? It happens only every 10 years, so we tend to forget about it until 10 years later. But it seems to me that the time is now to be thinking about what didn't work and then prepare that for the next census.
Right.
Have you given any thought to that about whether it would make sense to move away from kind of elected officials getting their fingers on the map as
Right.
opposed to having a totally independent citizens commission doing it?
I think you're right. I certainly think that the independence to keep the elected officials drawing their own map for their own lines, I think is really important because it's frankly self-serving in many ways. In
or
the
at least it appears to be.
Right. So at least on the counties redistricting, I would say one of the concern when I first looked at it was I was very glad to see that the commission, the independent commission that was appointed, 15 individuals from all walks of life in all different parts of the district, of all ethnic background and pretty balanced and gender as well. That came up with six recommended maps and then narrowed down to 3. And eventually, at least for the county, the final map that's adopted was one of those 3, very, very close to it, that was being approved. So I'm very happy to see that that was the process that county was able to follow. And certainly there have been proposal, even though after we have the commission, some other of our supervisors did try to pull map that was thrown, like basically did not get voted in. We're trying to resurrect those maps that they like better. So I'm glad to see that the ultimate passage was something that is according to that independent commission's recommendations. So I think at least for the county right now, this go around, I think there's always room for improvement, I think, but all in all, I think we were able to stick with the spirit of the outcome. And then of course, I personally am quite concerned how Sunnyvale has been for decades been split into 2 different districts, which dilute the vote. And so that being changed to having the city being belong to one supervisor district was something that I did care for, and I'm glad actually all 3 maps that was recommended by the commission actually had that accomplished too. So that was really good. So I thought, all in all, I thought it was a fairly open and transparent process.
Yeah, I think that San Jose and Santa Clara can be at least had an advisory commission. It wasn't totally done behind closed doors among just the existing elected officials. So that much we appreciate, although there still isn't the public perception because so many decisions are made at the last minute by actually the elected representatives that there's not necessarily the sense that it was as independently done. We have a specific question back to mental health. One of our league members asked, the problem with trying to help and support young people is how do we work with them or provide them services or guidance, as you talked about, before they're either severely or diagnosed as severely having issues. Can there be some earlier intervention in a preventive mode? You talked about your own personal experience, which thank you for sharing that with us. I know specifically for Asian families, mental health is something we deal with culturally, but
yeah, exactly.
You acknowledge that was, you could have gone either way. How can parents, how can adults help young people without having to go through until they're really bad, I guess? Thoughts about that?
We really need to treat these type of issues, mental health issues, no different from physical ailments. The hard part about mental health issues is that it's not very visible per se. You've got a cold, you're sneezing, you have a fever, right? You can measure the problem or an injury or something like that. You can see it, right? The problem with mental health is harder to see because physically you look at the person, looks okay, but if you are a family member and how they act, how they speak something, what were they reacting, that the individual is suffering from some type of mental issues of that day. So I think it is so important that the loved ones of those from the family who recognize this is able to help to get the help, because very often the individuals are not the ones who would go out there to seek the help because of these type of stigma or not knowing where to go, right? So I think it's so important that if we have these services being made available, that you actually do ask for help. A lot of times actually they start with the doctors on the physical health side, because when the referral comes from your own doctors, nurses that you work with, you have that built-in trust. It's much more likely that that's probably where could provide the door into seeking the help. I think it's important. Now we talk about various programs, like we have the schooling services where youth would first start with some type of diagnosis on the mental health, and they can get support from the school districts through this SRS program, and if it's available. LCOVE is what I mentioned earlier in Palo Alto, will be one that youth could join, especially in North County. There are other prevention and early intervention programs to help intervene early in the development of emotional and behavioral health problems in some of the schools' children. There's this called the Kids Connection Network, KCN. It's for birth to 5-year-old. It's a system of care that provides developmental and behavioral health services to the youngest population of a county and also the family. And there's, of course, also the mobile crisis team we call the Uplift Family Services for those type of crisis intervention. And then we also have the Behavioral Health Call Center that could connect the youth with the Medi-Cal and mental health services as well.
Well, thank you. Actually, there was a question or a comment made thanking you, or for thanking the county for its mobile crisis response team. Could you spend a little more time describing what that is, its hours of operation, how it works? And I understand it also most recently that the county has just voted to expand that program, a program that's been for a while.
It's a program.
You're expanding that.
Yeah, it's a program that really needs to be 24/7. It's unfortunately, obviously, even though that's technically the advertised hours, the staffing, of course, is not the same necessarily at all hours. And it's very clear that the number of people we need to staff it, we are not fully staffed at all. And we have the budget, we've allocated the funds. We just really need to get people hired. One of the things we also identified in the behavioral health area is that the number of individuals going through the pipeline to be trained professional social workers, psychiatrists, and with that type of proper training, actually the pipeline education is actually very narrow. We just don't have enough slots in the schools, even though there's such a huge need. So one of the things we really need some of community colleges and universities to be offering many of these type of certificate programs and other type of degree programs, so that more students will be able to get through the program for us to hire. Because I tell you right now, this is the area that you study in school, you have no worry getting a job right now in the Bay Area. And I would imagine most places in this country, because with the pandemic of COVID, the need for mental health has just gone exponential. So there's just so much need out there, and the mobile crisis team is one that we are very proud that we have, but certainly it's not enough to meet the need throughout the county.
Yeah, and I think that's a good word, is that we know that there are staff shortages. And in fact, there's a concern about that. Is the county, I mean, obviously it's a problem that there just aren't enough people in the pipeline. You just said that. That was one of the complaints about sort of the mental health, is that there's inadequate staffing for a lot of these. Yeah, so
you don't want people to seek help and then they have to schedule it 3 months later to see somebody. That's
right.
Right.
Yeah, that doesn't work. Okay, there's a question that another question that has nothing to do with mental health, but it has a concern of our members asked about making more of the I guess the county documents and information materials available for the handicapped in terms of access. So I it's not a high priority perhaps, but the league certainly believes in transparency and having information available, but sometimes access is limited because you have a visual handicap or a hearing handicap. So is that something that the county could focus on?
No, definitely. And as you said, physical handicap sometimes is more visible. Problem, mental issues is that it's not as visible. And that's why trying to identify and try to provide help and getting the help tends to be more difficult. Mhm.
Yeah, certainly we're familiar with the American Disabilities Act and the
That's right.
requirements, but
Mhm.
there are just quite a number of things. I'd like to go back to some very specifics. Has there been consideration of support for providing free VTA passes for high school and college students, especially for those who are limited income, dealing with problems of affordable housing? Is that something that has come up with the county?
Yes, I certainly personally am very much supportive of having some type of like why not, right? For our students to be able to use public transportation for free. Too often we've all seen, well, COVID certainly does a number on people not wanting to be on public transportation, right, for the fear of transmission. And we've seen too many times you have these double long VTA buses going on now Camino Real with maybe 3, 4, 5 people in there when obviously capacity is many folds. So when you run buses that's practically empty, does not serve anybody. And so we do know that, for example, community colleges already do that. Is that if you sign up to study in community colleges, any classes, there's a nominal fee per semester that's already collected as part of the registration fee to provide unlimited rides on the VTA. So
Oh, I didn't even know that.
Yeah, exactly. So it's already there for if you go to De Anza, you go to San Jose Community College, City College, it's already have those programs for the community college students. And I think we really should do that for high school kids as well, so that they could get around. And certainly, the fare that we collect on the buses is practically like 12% of the cost. The so-called fare box recovery practically not only non-sufficient, is such a small part of it that sometimes it might be better off to just let people, and especially at the end of COVID now, with oil prices, with gas prices right now, I heard the average in California is now $5.60 a gallon, something like that, right? So I would think this is actually an excellent opportunity to provide very low cost, or actually in this case, hopefully free public transportation for VTA, both light rail and buses, to so many more people, so that people will get out of their car, right, and finally come back and ride public transportation again, now that we're kind of like, getting out of the COVID mentality. So I really think this is a great time to implement these type of programs.
Thank you. I just want to point out a couple of things that were in the chat. People might want to join Supervisor Lee and his meeting. I guess tomorrow you're doing a session on behavioral health if people want to get into it more. Mm-hmm. And there is a link in the chat to that meeting that has been provided. Thank you. Also, a comment that from one of our members, Susan Scory, that the Catholic Charities does provide sort of some one-stop shopping. Again, another example of a community partner that I'm sure the county works to. But so I think what we're hearing is a lot of good things happening. We may not be aware of it. Sometimes it's a little hard to find, but there's a lot of work that the county is doing, especially in the last 2 years, I suspect, last few years in developing, trying a better approach to mental health, and especially in this time of COVID. I think we are getting close to our closing time. I'm going to want to turn it back to Carol and I want to express my thanks to you, Supervisor Lee, for all that you're doing. You have this military background, so I'm sure you're really good at logistics and getting the kind of things done, I hope, at the county. So
I'm actually a career logistics Navy officer for supply. So that's my specialty of getting things together. A funny story is that my last general that I worked for, he was at the time a brand new one-star general in Iraq in 2009. And when I was leaving, long story short, I saw his name on the paper about a year ago. Turns out he was the SAR at the time appointed to run the Operation Warp Speed to distribute the vaccine. So obviously vaccine was something that we were very much shortage of. So I reached out to him, asked for help. And anyways, long story short, we were able one time get a 300,000 vaccine to our county. And that certainly was a game changer. And since that day, we've never had a shortage. And I'm very honored to say that, it's all about logistics.
Yes,
Yeah.
and I thank you very much, because I think that Santa Clara County has been very fortunate with its public health officer in terms of the leadership there. So thank you.
Right.
Back to you, Carol.
Yes, thank you so much, Supervisor Lee, especially for giving up your lunch hour in your very busy day. I know you had a meeting right before and you've got more coming up afterwards. So we want to thank you very much and for all the information that you gave to us. Thank you.
Well, thank you for having me. And obviously, if there's any further questions, please do reach out to our office. I gave out the phone number and also on the chat box. And really,
Yes.
thanks for having me. The conversations like this really help improve our wellness and the care of our county and our community. And, talking about it is very important so that's how people feel like they are not alone. And I'm very thankful to have the opportunity to speak with all of you today.
Yes, thank you. Thank you so much. I just wanted to announce to everyone that our next Lunch with League next month, which is April 21st, and we are going to host Michelle Young, who is the Senior Management Analyst for Recycling and Waste Reduction in Santa Clara County. And so she'll talk about what's happening to our recycled food and other organic waste and what the government, different levels of governments are doing and businesses to help mitigate all the problems that we're seeing here. Then in the third Thursday in May, don't miss Joe Matthews. He is a syndicated columnist in about 30 newspapers in California, including the Mercury News. So his columns are always interesting. And this event promises to be fascinating too. So watch for our newsletter or the newsletters of your league for other upcoming events. And thanks to all of you for joining us today.